So I was asked to speak here today about the future of wearables and the potential impact on healthcare. And as I started thinking about what that discussion would look like, I realized that we can't talk about the future of wearables until we reconstruct the present. So as we all know, the healthcare industry is in the midst of big changes. And some of those factors, healthcare reform, societal shifts, technological advances. So let's briefly talk about those changes as they impact the future of healthcare, and then let's talk about how wearables are a part of that. So we're moving towards a system of DIY healthcare, or self-care, with an importance placed on empowering patients to take a more proactive role in their health management. And as an industry, we're prioritizing preventative care, we're integrating or attempting to integrate big data, and we're moving from a fee-for-service to a fee-for-outcome payment model. And naturally, when you have these kinds of changes, the role of the patient and the role of the physician is going to change as well. And the relationship between the two is evolving from a paternalistic one, where doctors give orders and patients follow them, to one of shared decision-making, with patients asking more questions based on the research that's available to them, and just generally being much more knowledgeable about their own health state. So what role do wearables play in these bigger changes? Can they improve the evolving and sometimes disjointed doctor-patient relationship? And can they ultimately help drive forward a more efficient and cost-effective system that will result in more positive outcomes and ultimately more personalized treatment? We have seen no shortage of companies entering the health space with the goal of doing just that. And it's not the traditional health companies that we're used to. It's the tech giants. It's Apple, it's Samsung, it's Google, and they're investing more than $1.4 billion in wearables in just the last few years alone. But their presence in healthcare is still experimental. And the products that they're introducing to the healthcare market are experimental as well. And while all of these companies are no doubt upping the cool factor around health and making it front and center for consumers, most of the wearables being adopted today are fitness and activity trackers. And those are seen by the general population as still being novel. So even though one in 5 Americans owns a wearable of some sort, how many people in the audience here are wearing Fitbit, Jawbone, Apple Watch? Okay, you might be the 1 in 5. Less than 50% continue using it after 3 months. So it's not that there aren't great wearables on the market already, and we'll hear about some of those from our panel following, but the challenge is that we still see some gaps in the progression, the development, and the adoption to take these products from experimental to widespread and long-term use at the clinical level. So how do we get from where we are now to where we need to be? And that's what I'm going to focus on today, these gaps. As is the case with any new technology, innovation lives within these gaps. And when we're able to close them, we then have something that changes the game. So let's talk about 3 main gaps as they relate to health wearables. First, the lack of actionable information being provided to consumers. And second, the ability to connect multiple devices and integrate data. And lastly, the need to keep the personal nature of the doctor-patient relationship. So we talk about data and having information, but unless that information makes you do something, it actually does nothing. And I thought about this as I was having brunch with a friend of mine, Kelly, a few months ago, and she very excitedly told me that she just got a Fitbit to help monitor her sleep. And when I asked her what she's trying to find out, she said she doesn't sleep particularly well. And obviously she knows that by how she feels each morning when she wakes up. But beyond that, she was clueless about her sleeping patterns and what she could do to improve her sleep quality. So ultimately the question becomes, is the Fitbit going to tell her something that she doesn't already know? And is it going to help her improve her sleep? So I followed up with Kelly a couple weeks ago as I was preparing to speak here today, and I asked if she had any more insight into her sleeping habits since we last spoke. She told me the Fitbit confirmed that she does not get restful, consistent sleep each night. Now, there's no question that the Fitbit is providing Kelly with information, but it's not just about providing information. There's a lot of information out there. And it might be interesting to her to know that she wakes up several times during the night, or that she only sleeps for a few hours consecutively. But then she's left to figure out why this is the case and what she can do about it. So in this instance, the Fitbit only confirmed what Kelly already knows. So what? And the gap is that we need wearables to provide actionable, prescriptive information. Data is only as valuable as what you can do with it. Kelly's Fitbit needs to help her determine what to do about her poor quality of sleep in order for it to provide long-term value. And as consumers, we like to play detective, especially when it comes to cracking the code on what's going on inside us. We like to know why something is happening, but ultimately, we want answers. So why am I not sleeping well? And then tell me how I can fix it. Now, it's not to say that there aren't any wearables on the market that don't fill the gap of providing actionable information, but Kelly's story is not unique. We need the next wave of wearables to be driven by human-centered design that provides a simplified and engaging user experience that, most importantly, answers why and what do I do now for consumers. So let's think about each wearable now as an article of clothing. I have my jacket, my shirt, my pants, and you need multiple articles to have a complete outfit. Most of us do. And that brings me to my next point about the connectivity gap. As I mentioned, there is no shortage of companies with wearables of some sort on the market. In fact, some experts estimate that there's anywhere from 200 to 250 different fitness trackers and health wearables available to consumers. And that number doesn't even take into account the more than 50,000 apps that are dedicated to mobile health. The challenge is that very few are integrated or comprehensive solutions, meaning that it's difficult to find a single device that will capture multiple data points, heart rate, and temperature, and glucose levels, and respiratory rate, and so on. Yes, there are several devices out there that can do one or two of these things, but if I wanted a holistic view of my health, I'm left to put on or attach multiple wearables. And that actually reminds me of a story that I'd like to share. A colleague of mine has a husband, John, who has type 1 diabetes. And to monitor his diabetes, his glucose levels, John uses a device from Dexcom. But John's also very active, so he uses a Jawbone tracker to monitor his fitness levels. However, John also uses a separate sleep tracker to get more specific information about his sleep patterns. Now, despite the fact that none of these devices are individually providing a holistic view of John's health, they also aren't connected to each other. And it's almost comedic because John needs to log into 3 different portals and he needs to review 3 different reports of information. And then he's left to connect the dots between his glucose levels and his activity and how that might be impacting his sleep. And that's pretty exhausting. Let's be honest, if technology isn't going to make our life easier, we're not interested in it. Now, granted, most people don't have more than one wearable, but that leaves only a few options for anyone that wants more than just a partial view of their health state. There remain numerous gaps in connecting all of this data. And as more and more companies introduce wearables to the market, we're seeing a surplus of disparate technologies that each operate differently on different platforms, provide different types of data, and have different methods for accumulating information. There are a few companies out there, Qualcomm Life, Ideal Life, that are working to close the connectivity gap. And these companies offer a suite of products with the goal of accruing data from multiple devices to get a full picture of one's health. And having this full picture is critical to be able to effectively manage our health and ensure that we're solving underlying health issues and not just addressing symptoms. So to make a wearable valuable, it needs to be connected to a larger system. And we've talked about actionable information and connectivity now from the patient perspective, but let's quickly take a look at wearables from the lens of the physician. So how would a doctor feel if a patient showed up for an appointment with a suite of data in hand? Now let's go back to the story I mentioned about my friend Kelly, because she actually took the data accumulated from her Fitbit about her sleep habits into her doctor. And her hope was that he would review the information. Together, they'd come up with some sort of conclusion about why she wasn't sleeping well. But the challenge, as I mentioned before, is that Kelly's data only confirmed what she already knew. And having this data on hand didn't provide her doctor with anything she couldn't already tell him. Kelly's doctor still had to give her a physical exam, and he still had to ask her a series of questions, and he still needed to order a panel of tests in order to identify the underlying cause of her sleep issues. For data generated by wearables to be useful for physicians, it needs to first be clinical-grade information. Physicians need to be confident that the data that they're receiving about a patient is accurate. And wearables like Fitbits and Apple Watches and Jawbones aren't regulated by the FDA because they're not used for diagnosis and treatment. If the data can't be used in the exact way that physicians need to use it, then there isn't an incentive for them to treat it as valid information. And that's not to say that physicians don't encourage patients to utilize wearables for behavioral modification, but the second challenge for physicians is integration. Physicians already have to manage a significant amount of information. It's not necessarily practical to expect them to interpret all of the data that wearables can churn out, especially in the case of my colleague's husband, John, who has 3 different devices providing 3 different types of information. Now, this doesn't even take into account the fact that many health systems' records are on segregated platforms, meaning that the ability to share patient information between doctors is not as easy as it should be. With wearables, we're adding even more data to the pile, yet we're not giving doctors an easy way to access and share it. So how can we better standardize and streamline this information in a way that makes it easy for doctors to access and share across different channels? And the last, and one of the most important things that we need to keep in mind, is that while the emergence of these wearables is really meant to empower patients and drive us toward more personalized health care, we also run the risk of technology actually depersonalizing it, especially when the doctor-patient relationship is already in a state of flux. We have to find that balance because by its very nature, healthcare should be personal. We have to recognize that technology can't replace certain human aspects of care. Doctors have experience that provides a unique insight into the meaning and significance of health. And medicine is less precise than we all think. It's part science, part art, because each patient is different and diagnoses are less black and white. And although disjointed, the doctor-patient relationship cannot be underestimated, particularly for patients who've had long-term care. So in conclusion, it's no doubt great that we have companies like Google and Apple and Samsung that are really igniting this conversation around health. But in order for wearables to finally move from trend status to integral part of daily health management, and reactive data consumption to proactive, predictive analytics, we need to close the gaps. We need actionable information, connectivity, and integration, and a shift in perception and behavior from every stakeholder along the patient journey. We're headed towards a $50 billion market for wearables in just the next few years alone. So how will you be a part of it?